Welcome to Dental Success Beyond Chairside, the podcast that is dedicated to revolutionising the way dental professionals succeed beyond the dental chair. Join us for a unique blend of insightful interviews with industry experts and valuable tidbits of information to help you thrive in your dental specialist practice. In each 20-minute episode, we'll delve into a variety of topics, including HR, marketing, innovative techniques and systems, and AI, to help you transform your practice and unlock its full potential. Whether you're a dentist, specialist, or oral health therapist looking to enhance your practice, this podcast is your go-to resource for professional, personal, and profitable success. Get ready to go beyond the dental chair and discover what lies ahead in your practice journey with Dental Success Beyond Chairside. Welcome to Dental Success Beyond Chairside. Did you know your practice management system could be the brains of your entire operation? In today's episode, I'm joined by James Manny from Carestack. James is a recognised leader in practice management technology and a driving force behind innovation in the Australian dental space. With over a decade of experience spanning healthcare and tech, James has helped practices streamline operations, reduce complexity, and scale sustainably, all while improving clinical, operational, and commercial outcomes. James, thank you so much for joining us here today.
Michelle, thank you for the opportunity to be part of this podcast.
Not a problem. We're looking forward to what you have to share. Can I just start with a little bit about your journey and how Carestack is supporting practices to grow smarter and in more sustainable ways?
I started with the Straumann Group Australia in 2020, and at the end of 2022, I received this email that Carestack, an investment portfolio company that Straumann had invested in $50 million in. The product landed on my desk in early 23. I was asked to drive a go-to-market plan and understand the market landscape, look at the current technology that's out there, what would be the needs and pain points of customers and patients, but also understand innately the digital ecosystem and how that was run. And at the time, I didn't realize the broadness of Carestack, but then over the 6 months of exploring not only the product, but also the competitor landscape, we just recognized it was an absolute dominant product for the Australian landscape.
Excellent. So what did you find and how do you differentiate yourselves? Obviously, we're talking about the digital landscape and how it's helping practices. What sort of technology and innovations does
I think,
have?
yeah, it's a really, really good question. I think it's the line in the sand has been definitely drawn, right? We're looking at digital workflows today. And at the moment, digital workflows are fragmented across front office, phone systems, imaging, design, AI, diagnostic tools, to iOS scanners, to software. All these digital tools are fragmented tools, and it takes up a lot of time, but also that patient journey is quite long and lengthy as well. Let's just, from an example perspective, the previous softwares, they're essentially built around the clinical aspect, or the clinical excellence aspect, right? So that entire journey built around that provider aspect. But over time, what we've realized is there are actually three pillars, not one. There's commercial excellence, operational excellence, and clinical excellence. When we look at a PMS today, and it's not just about an ecosystem of the software within itself and having a whole myriad of features, it's about how does it actually drive practice management. If we look at that, it needs to become an ecosystem, an adaptable ecosystem across all different levels of tools, but be the center of truth to everything that evolves around it. It should connect into your phone calls or own phone systems. It should connect into your diagnostic systems or AI diagnostic tools. It should have automation, or should say Heidi Health notation, AI notations. And you've got design software like small design software for patient conversions, treatment plan tools. Then you've got your back end, of course, operational tools from an accounting software perspective. All these specific tools should be part of what we see as an interdependent relationship, not an independent relationship, but one that's interdependent. Now, I'm going to just go back a little bit and let's look at the format of production and how we define production today. Up until 2024, I think the advancement or innovation was perceived to be minimal clicks in the software and a better interface, nicer looking display. And yes, of course, your text messaging and reporting features, these are all standard and they will evolve over time. I think a baseline is the expectation that apps, engagement tools, reporting, dashboards, these are all given now. They're the standard. Where we're going towards is what Apple did to the phone system, to actual mobile phones. Nokia, Motorola, they were all literally redesigning phones on the same breadbasket, that they had a good product. Camera was added, calendars, Tetris games, and so forth. But then Apple bought in and said, hold on, your communication tool should be more than just a phone. It should connect your banking, your social media, your emails. It should connect a whole myriad of tools into your communication hub. So when you look at a PMS, we see the world in exactly the same way. It should be a centralized hub that connects all relevant tools. If you look at a patient's journey, an example, patient comes in, they scan, of course, with the Trios iOS scanner. The workflow gets loaded up into the Unite software. That Unite software should speak to the PMS. It should load the lab work into the PMS. And the notification automation should happen to the patient automatically, all while the patient is notified to make that rebooking appointment. Instead of that actual production workflow being weeks at hand, it's to decrease the delta into days, right? That's where this is about. And I think the perceived notion that we have to minimize clicks, that's seconds and minutes that we're working with. I think iteration of software would automatically reduce that over time. So when we look at software, you have to see it in this part. It doesn't matter which industry. There is the iteration of bugs and configuration. Then you have optimized workflows, which are features which get better and better. Then there's innovation. Those are the three components of innovation, or I should say the sequence of elevated software in any given game. We see this at Carestack as well. Like our iteration into minimizing clicks, we know that's eventually going to get better and better. We also know that the implemented features that we currently have, they're going to get better and better. But where does the difference lie? The difference lies is when that first patient calls, is that patient being tracked across the PMS to the chair, to the actual scan, to the lab, back into the PMS, notification back to the actual patient for the patient to book again? If that entire delta can be decreased from a timeline of weeks into days, into one day, that is essentially speed of production. That's our goal at Carestack. We see that this is the frontier of change when we're talking digital. I think the PMS is part of that digital structure in today's landscape. From an interdependent perspective, we are one, or should say, the center of truth, or the PMS is the center of truth that should connect all your tools, your phone systems, your CRMs, your diagnostic tools, AI tools, and of course, your accounting software into the ecosystem to drive production.
Excellent. I think your analogy with the Apple phone was really good, James. I think visually people can understand how it works. So you've got your API integration, obviously, because you're a cloud-based, and then everything can integrate with the system more easily. I love that you actually talked about the phones, like the first phone call. Obviously, a person does a lot of research before that first phone call, but that first phone call is really important. And understanding how you communicate as a team to that person can be a real competitive advantage. So what you're saying with regard to doing the phones is that it's being recorded, is that right? So you can hear what's going on and perhaps give feedback and help with training?
AI tools from a phone perspective is on two channels, perspectively, right? One is a very personal relationship where there's a human interaction. We see this as that we want to empower dental office teams, not take the actual workload away. But of course, that human interaction in the world of AI is only going to be more important. It's going to be more valuable. Yes. So how do you empower dental office teams to use AI to get better? Let's look at things like, okay, are we truly empathizing with our customers or patients? How are we actually driving that patient to the books and, of course, scheduling that patient in? And are we following up those patients? Now, the second channel that, of course, is heavily marketed across many tools is, of course, AI receptionist, which is a bot, right? Now, in every industry, there's a bot now, in human nature. We all draw to wanting to speak to someone. I mean, we've all been part of some sort of phone queue where there's a bot on the other end and we just want to speak to a human being on the other end. Yeah. This is where Carestack, because we see this like, come on, we're in healthcare. while AI should be used as a tool, maybe after hours, it may work, be busy durations or even on weekends. But during the hours, if you're in crisis as a patient, the last thing you want to do is talk to a bot. You want to speak to someone with empathy to say, James, I hear you. I hear you're in pain. Let me speak to Dr. Janice and see if we can triage you on the phone. I'm going to see if we can get you in today because I know this is an emergency. Connection, that relationship and that empathy in healthcare, that is the difference. Each practice today, their role is essentially to dominate their region, right? Dominate their suburb. That's what they want to do. There's in each suburb, there's probably 3 or 4 dental practices, and it is war. They want to be number one. They want to be the first one where the patient jumps on Google, looks at it, and then calls the practice. Now, of course, yes, to some extent, I think there is a place for virtual bots. I mean, Voicestack, one of our products, has a virtual bot, virtual assistant. Do we see that being the primary focus? No. What we see is how can AI elevate the experience and the tonality and the relationship of patients, not just inbound, but also outbound. The other aspect that it also does is that it's a note taker for the team. I mean, you think about this. In a few minutes, they have to note down on a Post-it note or a pad, listen to the patient's concern, answer the patient's questions and ask questions, show empathy, schedule the patient, and give confidence that there's going to be a follow-up, if there is a follow-up. Do that for a 3-chair or 4-chair practice. Here's the numbers, and I'm going to lowball it. 20 calls a day, 100 calls a week, 400 calls a month, 5,000 calls a year. And we have two people sitting at the front desk managing 5,000 calls a year. When we think about it like this, you've got to go, well, hold on. We have to be dropping the ball somewhere. Where is the commercial excellence that we approach, that we help our teams get better and better, especially when we raise more production, especially when we get busier. So Voicestack on that aspect is an absolute game-changing product that enhances the quality of care and patient communication for dental practice teams. With that, in addition, they also have the facility of that virtual assistant if required after hours. So it's a win-win approach on both aspects, but from a business perspective, being able to dial down and say, hold on, last month we had 5 implant calls, we booked 4, we let 1 patient go. Let's reach out to that patient. What did we miss with that patient? How can we learn from that patient so we don't do that again? Or how can we improve that communication process? That then is pushed into the PMS. That call is recorded into the PMS, in the patient's file, or in the actual memo of the actual account. In addition to that, the PMS should have a dashboard for treatment plan conversions, which is a follow-up, right? When they do follow up that call, you want to be able to track that call. If you're looking at conversion rates with follow-ups, you want to see where are we going wrong with our calls? How can we improve our calls with our patients to increase our conversion rates? Yes, the phone AI tool is the first line of defense, or I should say first line of attack for conversions. And of course, that feeds into the PMS.
Yes, and that's what I really advocate, is that it's all about that relationship and building the trust with the patients, being able to communicate openly, two-way communication, understanding what you need to do, and then utilising AI, other types of systems to be able to give you time to do that is fantastic. When that patient rings, and as you said, the receptionist is chatting to them, they're empathising with them, then the system's able to find that appointment quite easily, make that appointment, and it can follow through. When that patient comes in and it's a recorded message, you can actually hear in case you miss anything, so it creates the notes. Then you talked about when they come in, just say if they're a new patient and then they come in for that first consult, you use the AI scribe, Heidi Health, which is fantastic. That's then reducing the time so the clinician can actually spend the time with the patient as well. And then you're able to track everything because your scanners are all integrated with the practice management system, Carestack.
Correct. I'll just go back on Heidi Health as a prime example.
Yes.
On average, we talk to dentists. And the majority of dentists, a good 86 to 87% of dentists leave their notes till end of day. They spend anywhere between 30 minutes to 90 minutes per day. It equates to over 5 hours a week. Now, if you look at the salary, or I should say the hourly rate of a dentist, maybe anywhere between $200 to $400 an hour. If you look at that and you're spending 5 hours a week, that's $1,000 of your hour doing notes. Imagine if you're able to utilize AI doing the notations, and that 5 hours that you're spending in the afternoon when the doors close, imagine putting that into production exploring unscheduled treatment plans. All of a sudden, your hourly rate goes to production rather than doing administrative tasks. I think the Heidi Health integration is, on a Carestack perspective, it's not just a plug-in integration. It's actually baked into the product. We've built Heidi Health into Carestack. It's all part of the seamless workflow. You wouldn't even know that the Heidi Health was actually within the actual software. I think the following into this is also the CRM aspect, right? Let's have a look at what one of the aligner companies did in 2011 and 2012. They went direct to market, Michelle. They said, we will tell you which orthos and which dentists to go to. Patients are like, well, hold on. Do we have choice now? That changed the behavior from patient care to consumerism. That actually created marketing, because all of a sudden a corporate aligner company was telling patients, you need to go to a diamond or platinum provider. Here's the dentist you need to go to, even though you might have been happy for 10 years at your dentist, right? And patients are all of a sudden moving because there was this direct-to-market communication that took place. This was a fundamental move. This then brought in marketing into dental. When marketing came into dental, well, guess what? You had CRMs come into dental, right? The first channel that we all know is patient retention as a channel. That is the model, I should say, the software where the practice management lives. When marketing came in with CRMs, that was patient acquisition. That's a completely different tool. Now, up until now, you had this powerful CRM, this powerful PMS, neither of them talking to one another, hours of administration, double entry, following up, tracking the patient through a funnel, then converting it, trying to understand, did you call the customer? We don't even know if we did, or if we had followed up, we'd have to write some notes if someone was actually more detailed. Then actually inputting that into the PMS and then trying to bring that information back into the CRM if you're running a conversion tool. That's hours, if not days and weeks of work. Now, today, it's all seamlessly integrated into Carestack. HubSpot, Go High Level, Boxley are just some of the CRMs. I think there's a couple of other CRMs that we're looking at integrating to as well, because we know we're going to give them choice. CRMs, of course, have this innate flavor depending on the type of business model, right? So HubSpot or Salesforce might be for a larger organization, all the way down for a Go High Level, or a Boxley might be a single site practice. They've got this innate relationship with these CRMs. We want to be able to, for the practices, is to be part of their ecosystem. It's not the PMS to say, I'm going to create an ecosystem. No. We're one piece of the pie. The pie is built up of all these different tools that need to be able to facilitate into that central piece, which is the central truth, is the PMS. That's where Carestack actually innately is driving now. That change that Apple brought in is essentially the change we're bringing in, is the unifying an ecosystem to drive production through all your facilitated tools, empowering that actual production from the first phone call to the chair and then bringing that patient back.
Amazing. Gosh, is there anything else that you would like to share, James, that we haven't discussed?
Look, I think there's one story I always share, and I have to give kudos and credit to Woolies and Coles here. When the fast checkouts came in, we all fought it. I stood behind Jenny and so forth. I was like, I'm not going to scan my own food, put it into my own bags and put it into my own trolley. I'm going to stand here and I'm going to be stubborn. What did Woolies do? Woolies actually started shutting down lanes, which forced us into the fast checkouts. What happened? We realized, even though we were scanning our own food, putting it into our own bags, we were out 3, if not 10 times faster. The accelerated production that they were able to have more customers come into Woolies and Coles, drive through the fast checkouts where the customer had to scan themselves. And we're not complaining about it. I'll tell you what, I'm not lining up anymore. That's where I'm going, because I know that's my fastest exit. The notion of production, I think we need to really continually redefine. We can't say that, hey, something's worked for the last 30 years. No, evolution, there's a definite change. We have to look at different industries to say, hold on, this retailer's defined this so differently. How have we not looked at another better way to do it? It is about more patients, just as they've got more customers. It is about that journey from the moment the patient walks in all the way to the chair and back out. How quickly can you get your remakes? How quickly can you get your lab work? How quickly can you get that notification, give you that comfort? We've been designing an app for quite some time now. We're actually not too far from launching it as well. These are all part parcel, and this will be innovation I think a lot of PMSs will adopt. But I think the challenge lies in this place. how do you connect all the tools and seamlessly bring true ecosystem where, you're driving production, not only from a phone perspective, from a planning perspective as well, right? Yeah, it's exciting for us. And I thought I'd share that because it really did open my eyes when I look at how they've actually changed production for customers. We need to redesign, reinvent how we think regularly. We're not too far off an ortho feature. Innovation has not been in the orthodontist space for quite some time. I think we've all recognized this, and they pay a significant amount for very little value. But the tools that they require are no different to the tools that a dentist require, right? I think it's only fair to say we should always be looking at expanding our digital experience, expertise into different areas of dentistry, and the orthodontic space is definitely there.
Thank you so much, James. Thanks for joining us today, sharing your passion, explaining what Carestack is about. For more information about Carestack and James, please see our show notes. Thank you so much again, James. Have a beautiful day.
Thank you, Michelle. Thank you. Appreciate it.
Thank you.
Brilliant. Thank you. Bye.
In our next episode, we'll be talking about what it really takes to exit a dental practice and the options that aren't often discussed. I'll be joined by Craig Keegan from M&A Profits, who works with dental founders to build scalable, sellable practices. Craig will share a new co-op-based exit model that gives clinicians more control and can lead to better outcomes than a traditional path. Thanks for joining me on Dental Success Beyond Chairside. See you next time.